is one of the 9 regional coalitions across the state of Washington that make up the Washington Recovery Alliance. And we're so grateful to have you join us here today for our community conversation with 3 lawmakers. We have a state lawmaker, a county lawmaker, a city lawmaker who will be sharing with us about their roles in government and behavioral health in their regions. So we're just thrilled to have you join us here today. And I am going to pass the mic to Teresa, our tech person, just for a second so she can give us the tech 411 as we get started.
Hi, everyone. Welcome. I'm Teresa. I am the aforementioned tech support here on today's call. I'm the program manager here at the Washington Recovery Alliance. I apologize if I'm looking in all sorts of places. My little laptop has many windows open because right now there are 40 of you on this call, and that's so exciting. We're so glad to have you here. I think we're all pretty comfortable with Zoom here, but for folks who may be just joining or who have any questions, just a polite reminder to please keep yourself muted. We've got some fantastic panelists here today, and we want to hear every nugget of wisdom that they're going to share with us. I can be found if you have any questions, any concerns. You can shoot a chat to everyone. You can shoot a chat to me here. I have the 2 asterisks in front of my name, and throughout the day, or this next hour or so, as you have questions for our wonderful lawmakers, please put them in the chat. I'll be curating them, and we will be asking as many of them as possible throughout the day. So thank you so much. I will turn off my video and be behind the scenes, but available by chat, and I'm excited for today. Thanks.
Thank you, Teresa. So it's my great pleasure to get to introduce for you today our new executive director at the Washington Recovery Alliance, who is also going to moderate our conversation with our panelists today, Ellie Hernandez, who started in the beginning of this month. Ellie comes to the WRA from her position as a program manager at CMAR Community Health Centers, a community-based organization committed to providing quality, comprehensive health, human, housing, education, and cultural services to diverse communities. Ellie has a master's degree in clinical social work from the University of Michigan and is currently working on her doctorate of business administration from Columbia Southern University. Ellie, welcome. We are so grateful to have you with us and are excited about where we will all be going together. And with that, I pass the mic to you for the hour. Thank you.
Thank you so much, Heather. Yes, my name is Ellie Hernandez, and I'm so happy to be here. I'm so eager for all of us to learn from the panelists today. I think it will really help us be better advocates in the recovery movement at the state, council, city level. And so thank you for the audience for being here. We really appreciate your interest in this very important topic. For the King County Recovery Coalition for putting this on, and all that you do, it's incredible work. And lastly, for the distinguished guest speakers, we are so fortunate to have you here. We couldn't thank you enough. So let me introduce you to the panelists. They are Washington State Senator Manka Dhingra, Island County Commissioner Jeanette St. Clair, East Wenatchee City Council member Matthew Hepner. Would all the panelists be able to introduce themselves by speaking a little bit about your background, how you ended up in the elected office, what that entails, what your job entails, and what your role as an elected official connects with behavioral health? Can you tell us more about that?
Absolutely. Thank you so much, first of all, for putting this together, and thank you to all the people who are watching. Thank you for taking time off, whatever schedule you were on, to really care about this issue. As you know, my name is Manka Dhingra. I'm the state senator that represents the 45th legislative district, and that is the King County parts of the city of Woodinville, parts of the city of Redmond, Kirkland, Sammamish, and Duval. In the Senate, I chair a behavioral health subcommittee. I am vice chair of law and justice. I sit on healthcare, on ways and means, and I am also the deputy majority leader for the Senate. I am actually new to politics. I ran for office for the very first time in 2017. Prior to that, I was a senior deputy prosecuting attorney with King County, and I created and ran the Therapeutic Alternative Unit. So I helped run our regional mental health court, our veterans court, our diversion programs. I actually helped put together the 40-hour crisis intervention training for law enforcement and was an instructor there until the last month before I stepped down to run for office. I frankly decided to get involved in politics and run for office based on our national election. I really felt that you know, people who've been doing work like myself in the mental health field, I'm also an advocate for survivors of domestic violence and sexual assault, that it was time for us, and being a woman of color, it was time for us to stand up and really make sure that we represent our communities and can really help further the conversation around helping survivors, helping individuals impacted by mental illness and substance use issues. So that's why I decided to run for office. I've also been on the board of NAMI Eastside for 10 years. I have been president for, I think, 4 years. I ran the public policy committee for a long time. So, you know, mental health, behavioral health, substance use issues, domestic violence, criminal justice reform, those are all very close to my heart. And those are the issues that I spend a lot of time working on in the Senate.
Thank you.
So my name is Janet St. Clair. I'm the Island County Commissioner and I represent District 3, which is North Whidbey and Camino Island. My background was I had 30 years of wonderful 30-year career in social work where I was executive leadership in organizations that addressed everything from child welfare to senior services to refugee and immigrant services to mental health programs. I was extraordinarily proud of my team that helped launch one of the first integrative care programs under a CMS grant in Washington State, working with severely mentally ill consumers and partnering with an FQHC, because not only did we integrate the behavioral health and mental health care, but we were able to address the social determinants and create culturally appropriate ways to deliver services to a high-risk population. When I was at Lutheran, we were able to obtain funding through Robert Wood Johnson Foundation to create a very innovative refugee health screening tool that was the first mental health screener, to our knowledge, in the world. It is now being used in several states and 3 other countries. All credit to that goes to an extraordinary woman named Beth Farmer, who I was lucky enough to recruit and hire. Mental health is not only professionally important to me, it's personally important to me as a parent of children who have struggled with mental health issues. I am absolutely the proud parent of a peer support specialist, which I think is one of the critical ways in which we can support consumers. My husband and I moved to Island County in 2013. I was happily retired working as a volunteer in health efforts when I failed retirement, because I felt like access to care, equity, and addressing the critical needs in my community had to. So that led to my being elected in 2018, and love the work we do at the county level in this area.
Thank you.
Guess that leaves me. So my name is Matthew Hepner, and I'm a city councilman in East Wenatchee. I'm going to start backwards on this. My relation to recovery and behavioral health comes because I am an addict and I am an alcoholic. I'll have 8 years sober on the 26th of August. I still struggle with marijuana, but I am making grounds. So to me, it is a very real, very personal thing. Um, so that being said, I mean, it started kind of, I guess where I started was when I was homeless, living on the banks of a lake. Um, Ended up started the program, went through the steps, uh, and started digging myself out, you know, fight by fight, piece by piece. Um, and I was able to, get to a place that was good, and I could start giving back and doing things. Um, and that's what I've been able to do. I'm blessed here in the Wenatchee Valley to work with Victor Estrada. Uh, he's not only a great advocate for the recovery community and the behavioral health community, but he's also a mentor to me. He mentored me last night, and I absolutely love working with the Recovery Alliance. They are an absolutely amazing organization here in Central Washington. Um, and, in a small town, when you're looking at behavioral health and addiction, we have very limited assets in the Valley. And that's incredibly, that's a huge problem. I've felt it myself. Once you get stuck in that system, it is so hard to get those hooks back out of you. It takes years and years. But that's kind of how I ended up in an elected position. I ran for office and I won when I was about 5 or 6 years sober. So this is my first term, but I've absolutely been able to, I love being in the position where I can give back and help people that have been in the same place that I have. So it's one of the things that I'm most proud of in my life.
Thank you. Those are amazing backgrounds. Thank you so much for that. Let's get into it. So what role does your level of government, state, county, or city have in relation to the behavioral health system?
Do you want us to go in the same order we started?
Oh, that'd be great.
Okay, great. So, at the state level, we really want to make sure that whatever we're doing, we are allowing for flexibility at the local level. Because every community has a different way in which they address services. So what we can do is set up structures at the statewide level. So since I got elected to the Senate, we created the Behavioral Health Subcommittee. It's a subcommittee that didn't used to exist so that we can really focus on behavioral health issues. And so especially for the last 2 years, we at the state level have been really trying to ensure that we are taking a look at the entire spectrum of care, from the time of birth, dealing with maternal mental health, all the way to death. So taking a look at adolescent mental health, school-based systems, looking at outpatient-assisted treatment, involuntary treatment, forensic mental health, and a geriatric behavioral health system. During the last recession, we had really moved into a crisis response model. And so we've been trying to undo that for quite a few years. So especially in the last 2 years, we are emphasizing an early intervention model and away from the crisis response model. Really trying to make sure that we are able to provide access to care for people when they want it and when they need it. Really making sure that we are investing in a community-based system instead of, a state hospital type of system. So really taking a look, especially in the substance use disorder field with medication-assisted treatment, inpatient treatment, taking a look at recovery systems. We're so fortunate to have Lauren Davis in Olympia helping to really help with priorities over there. So I love working with her to, she in the House and me in the Senate, and really making sure we can come up with solutions that really help people. So we expanded access to inpatient care for adolescent, and really recognizing that it does take a village to raise our children. So making sure that we can talk about the role that families play in ensuring that our kids get the help that they need. We also last session worked on providing our tribes the tools they need to address ongoing issues around suicide and addiction. and really acknowledging and understanding how the civil commitment statutes work with the tribes, the rest of the community, making sure there's integration and communication between those two systems. So really taking a look at barriers to access at a statewide level that we can help with. Integration has definitely been a very huge component on that. And I can talk a lot more about the different committees we're on that really makes sure that we are addressing those issues.
Thank you.
So this is Janet, and I would add to the question that we have state, county, local, but we also have a regional response to mental health in our communities. And so that regional response is particularly critical in rural areas where we as individual counties may not have the same level of capacity that we have and leverage that we have as a regional, as we do in regional efforts. And as an example, we were able in the North Sound Behavioral Health Organization, now ASO, my colleague, Commissioner Jill Johnson, Jackie Henderson, our Director of Human Services, Joe Valentine and others were able to obtain funding, and we're building or just completing a crisis stabilization center in Oak Harbor. And that is a regional asset. It's not a county asset. That's an incredible intermediary place where when people are in crisis, and we historically, when we were in a crisis response mode, as the good senator said, we had a choice to take them to jail or take them to a hospital. And so these intermediary efforts enable us to take somebody at risk, whether it's a substance abuse crisis or a mental health or both, and give them 3 days or however long to stabilize, and then connect them to services and get them into both often, not often, more effective services where they can stay within their community. It's less expensive to government and often more humane than when we had to involuntarily hospitalize or incarcerate folks. So that's an area where regional response is critical. At a county level, we are the last stop for people in crisis. Our human service, we have a $110 million budget in Island County, and 12 million of that is in our human services. And that budget, we have some Medicaid resources, we have some private practice mental health services, we have NA and AA groups, but by federal standards, we're considered a critically underserved area in terms of behavioral health services. And so our human services and the investments we make there are critical as a safety net. It is not uncommon that someone was treated in the hospital, released, and shows up, walks down the block and shows up in the lobby of our human services, and they're still in crisis. And we're working, literally, I've had caseworkers drive them from county to county to get them hospitalized and get them the care they need. And that is a piece where we need to do better. So I'll talk about what we do well, but I'm also going to be clear that there are places where we need to do better. We need to do better with the fact that we have a safety net with holes in it, and people fall through those holes. And we need to make sure that we can connect them to services when they're in crisis. And I applaud the efforts to make sure that we also then are doing that early intervention and preventative care. We were a county that took on the ability to do the 1/10 of 1% sales tax early. And so we have dedicated funding to mental health. We use that for our treatment courts, our outreach efforts to do joint response with our police. That has been an extraordinary success. And our school-based mental health. That funding is eroded, and especially in the pandemic, we are seeing a significant reduction. And so while we're continuing to be able to do some of those outreach services, we've had to scale back our mental health services, and yet our healthy youth surveys will tell you that we still have kids as young, in my community, as young as 6th grade, considering suicide and having a plan for that. I'm trying to turn my noise off in the background. So the successes are there, the outreach, the joint response, the collaborative efforts. are absolutely there. And that's where county government is making a difference, using some of the tools that have been given to us by the state and by federal government through some of these large innovation grants. Where we continue to need help is we need to make sure we do that early intervention. If the state can have funding in our OSPI so that we can expand mental health in the schools. The schools, daycares, and after-school programs are often the first eyes on our kids at risk. They're often the first one to see those kids at risk who really need help. So we need to make sure we're supporting those efforts in our community.
Yep.
Hi. So our municipal police department, they're in contact with people in need of behavioral health services every single day. Our lowball conservative guess would be about 50% of the calls that we receive involve individuals who are
Mr.
involved.
Hepner needs to unmute.
I can hear.
Hello?
I can
Can
hear
you guys hear me now?
I can definitely hear.
Okay, so I'll start over. As a our municipal police department, we're in contact with people in need of behavioral health every day. And our lowball conservative guess would be about 50% or more of the calls we receive involve individuals who are with the behavioral health system or should be. The things we can do as a city, we can provide funding resources to agencies that offer support in the form of assistance for housing in conjunction with mental health programs. For example, we have the Housing Coalition, the YWMCA, and the Community Action Council. But we definitely do feel like we need more tools in our tool bag in order to accomplish what we need to get done.
Sure, thank you so much. Each role of the government plays a very important part in the behavioral health system, and the way in which they interact, it allows for a better behavioral health system. So how does your level of government impact the lives of people with mental health and substance use challenges?
So I can start and actually pick up some of what has already been said before. So, one of the things that we did 2 years ago at the statewide level is make grant money available to law enforcement so that they could start a co-responder model or a crisis mobile unit, or have a unique way or a different way of addressing mental health or substance use disorder calls that come in. And so a lot of local jurisdictions don't want to necessarily start a program without knowing where they're going. So at the state level, making those grants available, it was a really good way of ensuring that communities had that resources to be up and running. And then they could then decide how they wanted to proceed after they've had about a year of having that paid through the state. I'm so glad we had the mention of the mid 0.1% tax dollars. That's the mental illness drug dependency tax that many counties have started using. And that is also another way to partner with shared dollars with the state and those counties that are using that. So at the state level, we're definitely looking for partnerships on specific programs. One of the things that I'm very interested in doing is seeing how we can have peer advocates available in emergency rooms. We had a hearing of the Behavioral Health Subcommittee where we really talked about the experience of individuals when they go to an emergency room, and how can we make sure that that is a better experience. So ideas like that are things that the state can initially fund to make sure they're happening. The other thing we do at the state level is really making sure we're working with DSHS, working with the state hospitals, working with our Department of Health, working with our managed care organizations to ensure that people are getting the care that they need. So it's definitely at that umbrella level, but also trying to make sure we trickle money down for projects that can be creative or unique. And the more successful those are, we can then use our statewide platform to elevate them to a statewide level. So many times we see very creative, innovative stuff happening at the city and county level. And then we can take that and say, because they have already been successful, we now in a state can fund them and provide that model for a statewide experience.
So absolutely, and I will follow up that those innovation opportunities, we've got an opioid outreach team, we've got a social work outreach team. Those tools that the state gives us in our state toolbox are sometimes the only tools we have to fund those innovative services at a local level. So extraordinarily grateful for that. I will say that I'm very, very concerned that our mental health 0.1% sales tax dollars are significantly at risk across the state. And I saw that in the chat box. We are trying to figure out how we're going to do half or a third of what we've used to do in the schools because of the economic challenges to that source of funding due to the pandemic, at a time when our kids are more at risk than ever due to isolation and disrupted schedules and families that are starting to be challenged, and just the general anxiety and distress we're seeing emerge. And this, there's some wonderful SAMHSA information on the emotional and mental health impact of this pandemic. So it is one of those concerns for me. We use our staff currently to do outreach telephonically through Zoom, whatever we can do. And we often find that we'll have someone call us about a housing need because of what they're going through during these troubling times. And as our case workers in county government work with them and then refer them to our partners like Opportunity Counselor, the Stanley Community Resource Center, what we're finding is, yes, we may have met the housing need, but they still need, they start revealing their anxieties, distress, fears, and we start seeing behavioral health needs, or where somebody talks about a relapse, or in our seniors who are exceptionally vulnerable and isolated, they call in, and whether from the caregiver distress to just the isolated senior, we're seeing increasing behavioral health needs, where just that lifeline at the end of the phone is making a difference. But I would say that we're going to need to be able to attend to not just economic recovery and physical health recovery during this, but we're going to have a strong need to pay attention to behavioral health recovery after this time in our history.
So, hey, Ellie, can you redefine the question one more time?
Yeah, it's how does your level of government impact the lives of people with mental health and substance use challenges?
Okay. So regionally, looking at kind of the situation regarding behavioral health in Central Washington, East Wenatchee and Wenatchee, 2 different cities, 2 different counties. So the river is the border, but people go across the river, but sometimes funding does not. So we're the biggest city within our county of Douglas County. So we get a lot of people who are requiring help and services from a lot of smaller communities, up and down the river, up onto the plateau. These are small, rurally repressed areas. And we need to be equipped to deal with those members as well, those people that are in need. And like I said, it's always a funding battle. Currently, right now, for the most part, East Wenatchee, we don't have too many options besides to send people to incarceration or jail. We don't have the services that we need. That would be a great thing. I would love to talk to Senator Dinger about getting something in the capital budget about that. But that would be a great project, I think, for the Valley for sure.
Thank you. So then how do behavioral health services, and you've all talked a little bit about it, but is there anything else that you have to say about how do they differ in your region or state, in your region of the state, and what are the unique needs in your region?
So obviously at the statewide level, one of the things we have been very focused on since March is responding to the pandemic. In April, the number of people who were contacting the federal emotional distress hotline was up 1,000% compared to last year. The Washington Department of Health forecasts that because of COVID, we're going to see a 30 to 60% increase in Washingtonians experiencing symptoms of depression in the coming months. And so we're taking a look at all of that data at a statewide level and really seeing how we can support the work of behavioral health professionals. So, we work with the governor's office to make sure that behavioral health workers were essential workers, because we don't want to disrupt the care for individuals when they want to access behavioral health services. We, at the statewide level, have been really working hard to see how we can get inpatient treatments or residential programs access to PPEs. They were actually prioritized at a lower tier, and so I was making sure I was keeping a close eye on that and making sure we didn't have our institutions with COVID, especially Western State Hospital and even any of our residential programs. So the other things I'll mention is at the statewide level, really making sure that the healthcare authority was providing laptops to individuals and providers so that they could do telehealth services. We provided HIPAA compliant Zoom licenses to anyone who needed them. And I would encourage, if you're interested to look at policy at a statewide level, I have had behavioral health subcommittee meetings. They're available on TVW. And if you don't want to go to TVW and find it, I actually always post about it on my Facebook page. So you can only find a link. And it's a good way for you to see what's going on at the state level, what we're interested in discussing. I am very focused on making sure, and I do have to thank Laura and Tosh for her advocacy here. The last few meetings, I always try to start with the individual experience, because at the end of the day, our job is to provide services to individuals. So making sure we're hearing from them on how that experience is, what the problems are, any potential solutions that they have. So we're doing that work for the Behavioral Health Subcommittee, taking a look at the Behavioral Health Recovery System Transformation Task Force, which is huge. And that's really taking a look at evaluating our entire system, seeing how integration is going, and really making sure we're trying to iron out a lot of the problems. Now, I will tell you, these hearings tend to be very depressing because we're not hearing about the successes. We're hearing about the problems. So there's been a lot of great stuff that's been happening in the last 5 years, but just know that this is about highlighting the problems that we're having. One of the biggest challenges going on, I know it's been mentioned in the chat, is what's going on with our economy. Now, I, for one, have been telling any other senator or legislator that's going to listen to me is that what we did during the recession in cutting services for behavioral health cannot happen again. It took us years and decades to come dig our way out of that system. And so my ask is simply, don't touch behavioral health. We're finally at a point where we are starting to really change our system with integration and early intervention. So let's make sure we keep moving forward instead of going backwards. We do have the most regressive tax structure in the country. So at a statewide level, we are really taking a look at that. And one of the things I want to make sure we're protecting is behavioral health and ensuring that we really don't have cuts in that area. The other area we're very focused on statewide is workforce development. We know there's a huge need in our community, and we have to make sure we have professionals who have the expertise to do the work, and also that they're paid appropriately. You cannot have master level clinicians or people who have this amazing experience, lived experience, doing all this great work, but not being able to afford to live in the communities where that work is needed. So there's also a huge focus on workforce development and affordability at the state level.
Thank you, Senator Tingram.
So on a personal level, thank you for that last point. I have a son getting his MSW and planning to go into clinical social work, and I have
Yay.
another son who's a peer support specialist. So paying for a workforce that is adequate and skilled is absolutely critical, and I can't underestimate the importance of that peer support network at all levels of behavioral health. Now I've lost track of the question, Eli. I was so excited by Senator Finger's last point.
Well, we were talking about the impact that your level of government has on people with mental health and substance use challenges, but also what were the unique needs in your region, in your role?
Yeah, thank you for that. So I think what's unique in rural counties is a couple of things. One is that access to care is important, but it's greater than just access to those professional services. It involves our transportation systems. It often involves our emergency response folks. So I'm a big fan of telehealth through our fire and rescue and paramedic systems. And then there's the changing cultural understanding of addiction and mental health in rural communities. And just like in other communities I've worked in, the importance of reducing stigma, normalizing experiences, and helping people feel like those trusted advocate models that are so important, that folks can connect in ways that are supportive and humane and recognize the breadth of needs that they have. That I may be in a behavioral health crisis, but I will continue to be in a mental health crisis if I can't get housing, if I can't feed my children, if I don't have access to childcare. So the challenge of this work, from my perspective, for years at whatever level of government we're in, is that these things are all interconnected. And I would say what I'm proud of our state and our region through things like Medicaid transformation and the ACH, as accountable communities of health, are doing, is that they're recognizing that we have to de-silo the way in which we approach care and weave it together, because my experience as a person is going to be, I come with all of my complexity seeking help, and that complexity can't be siloed. I need to be able to have that. I think someone mentioned the no wrong door, one-stop shop. It is challenging and we're only partway there, but really that's the vision I have, is Main Street programming that is whole person-centered care, though that language that we know, but that really says, I can come to you with all of who I am and all of the needs that I bring into this room, and you will understand that my housing and my mental health and my parenting and all of those are absolutely interconnected.
Hello. Hi. So within city government, I think it's unique because it's often described as where the rubber meets the road. We get to see the problems firsthand, and literally see them with our own eyes. You take a walk along the loop trail and you see it firsthand. And we're in a position where if we are working effectively, we can actually help some. One of the unique issues for the Central Valley is, just take the weather. I mean, today it's going to be 107 degrees. That is kill you hot. We have people living in cars, they can friggin' die. In the winter, we get down to the zeros, negative numbers. I mean, it is real, real world issues. I mean, that will literally kill people. And working with Victor today, or last night, he told me some of the issues they're facing, and tried to provide showers, especially in a COVID world. So we have programs implemented, but then they're not always working on the ground. So, there'll be departments and programs that don't translate to real world action. So for now, we have a housing facility that has 75 beds available, there's only 5 filled. It's 170 degrees out. Where are these people going to go? Where are they going to shower? Everything's closed down, or everything's at 25 to 50% capacity. So we're getting more and more people that are on the streets, and less funding and ways to help them. So we're going to have to find ways to kick down some doors and loosen things up to get the help that these people need. And from a small town, it's the people in need are people these are, for the most part, these are people within the community, and we have to find a way to do better.
Thank you. And I really want to get to the audience's question. So I have 1 to 2, we'll see, of the questions that we came up with, and then I'll go to the audience's questions. But now that we know the role, what role each government, each level of government has in the behavioral health system, the impact that it has on people living with mental health and substance use challenges, and also the unique needs in each region. Can you tell me what your level of government can do about it? What can other levels of government do about it?
I'll just say, I think it's really important to continue to listen to people. You have to listen to the people who are dealing with these issues. You have to listen to family members who are trying to help their loved ones with these issues. You have to listen to the providers and people on the front line. I firmly believe that the people doing the work are the experts. And so they can help identify what the barriers are, what the problems are, and I think they're also the ones who have come up with the right solutions. And I mentioned in the chat, people were talking about silos, and I think that's absolutely right. We have to have flexible dollars available so that people can take a look at the whole person. And really, that's what integration is all about. You take care of the person from the head all the way down to their toes, everything in between. Because that's who we are as human beings. We are complex and we have multiple needs. We don't have needs in a consecutive manner. We have needs coming together all at once. And so I think a lot of it is that humility to understand and learn. And I think this is a work that we just continue chugging along at. And so the more allies we have, the more people we have speaking up, that's when things get done.
I think this concept, I know for years my frustration has been the need to be able to have to braid funding, and yet somehow as a provider, so I'm not speaking as local government now, I'm speaking as a provider. I think it is so, when the administrative cost of delivering services, and this is more of a federal government issue of what we need advocacy that says allow us flexible use of our funding in order to braid our dollars together to serve what we all are saying, the whole person that walks in the room. It's really hard when you have to say, well, I spent 10 minutes on that and 20 minutes on that, and address the funding that way. And that includes at the state level. If we can braid our funding, we all want to be doing evidence-based programming, but sometimes in rural communities and small towns, we can't do evidence-based programming because of the sample size issues. So we sometimes have to do elements of evidence-based programming in order to deliver services. And that's really important, that we be allowed to have some local flexibility to say, I may be doing some of the elements of one part of an evidence-based intervention, say early childhood interventions in our home visiting programs. I may not be able to do a fully clinically certified evidence-based program, but if I can pull evidence from our PCAP or our parent-child home programs or these other things and weave them into just delivering a service that is effective, knowing it and looking for those outcomes, that's important. And then being able to follow clients across this is why I'm a big fan of regional approaches. We need to sometimes follow clients across regional boundaries. Our systems that are county-based in a place where I live, where I cross 4 county lines to go to work every day, I need to know that if I'm taking my kid for services in Snohomish County because I live on Camino, that's going to work, and that that the counties and the jurisdictions can work together and the systems of care can work together, because it's got to follow the person and not follow some Byzantine government rule, and that's spoken as someone in government.
Thank you.
So if we're talking needs, you know, like my police chief asked and the mayor asked for me to highlight that we need a location that's a monitored location where individuals can receive the services needed. That is not a jail. Currently, you know, as a city, we've lost a lot of 976 funding we lost, you know, plus our retail sales are, you know, have plummeted. So we need funding. And this kind of goes into, there's a virtual cycle that I think is available if we play our hand right. That would be hopefully, like I was saying before to Senator Dingra, that we could get a capital budget project like that, and not just here. I mean, we need them all over the state. But one of the key issues in addressing a COVID recovery is going to be a robust capital budget project. So my trade, like my day job, is I'm an electrician first. So I came through the trades. I went through an apprenticeship program, and then, you know, I ended up doing politics for the IBEW. So if we get that capital project, you know, we can address recovery issues. We can address, you know, people being out of work and getting people in good real-time jobs that provide a living wage. And then we're building those projects in our local communities. So that way local people are working in their local communities, improving their lives and the livelihoods of their friends and their neighbors and their families. So, you know, a robust capital budget, and seriously, we need that facility.
Thank you. So let me go to the audience's chat questions. And this one was sent by Tony W. How are various levels of government addressing the overrepresentation of marginalized populations in the criminal justice system?
Is such a great question.
I know.
I've been a prosecutor now, you know, before I ran for office for 18 years. And that is, and especially now with the criminal justice stuff that's going on, I could probably take another hour and talk about that. But, you know, when I created and ran the therapeutic alternative unit, I used to tell people, I challenge you to drive me out of business. I would love a day when we close our therapeutic courts, because we are not arresting individuals with behavioral health issues. And so that's why in the Senate, we've really been trying to work to do the early intervention, but really making sure we are strengthening all components. So we're trying to make sure we don't have holes that people fall through. But really, it's a matter of making sure that we have the right response at the right time. Now, what happens is that, unfortunately, when you call 911, the only people who don't have an option but to show up is law enforcement. And so really taking a look at the program that Oregon has, the Cahoots model, is like, how can we make sure we have a different way of responding for mental health, substance use disorder, behavioral health responses, where everyone can be safe. You know, about marginalized communities, when you're talking about people of color, it's a whole different conversation as well, which I'm happy to have, and I've had multiple conversations about that. But especially in response to behavioral health, you know, it really is also about destigmatizing these issues. You know, people with mental illness or substance disorder are not more dangerous. It's they're more likely to be victims of crime rather than perpetrators of violence. Making sure people understand that. And I think, and I challenge each and every one of you here, I know you're already doing the work, so I'm speaking to the wrong audience, but, you know, let's make sure we're just destigmatizing behavioral health.
Thank you.
Yeah, I would agree with that. I think that's a challenge when you're working in marginalized communities or communities of color, is the importance of destigmatizing mental health and normalizing that this is something that happens in many families, and that we're here to help. It's why the trusted advocate model, the peer support model, the promotores model is so important. I would say trying to get people of color out of that are disproportionately represented in our justice system also has to be, for my county, it's about our diversion program. And we've been slowly evolving out here in our county to begin doing language access planning and making sure that we have interpreter services that are appropriate and not using family members or the Spanish speaking staff person that is available to take that call at that moment in time. So I've been focusing a little bit on language access planning in our systems of care, just beginning that work. That needs to be true at all levels of our programming, from public health to law and justice to our behavioral health and human services.
So on my city council, for the first time ever, we have 7 positions and a mayor, and half of those positions are now filled by females. Very intelligent, powerful, wonderful women. And I have to say, our city council has never ran more efficiently. So it is definitely paying dividends. You know, we are actively trying to recruit people of color. We do have a very heavy Hispanic population in the valley. On the Wenatchee side, they are running for office and they are winning. So, you know, change comes slowly, but it is coming, and we're working on it, and we're, you know, ever diligent about that. So it's a long process. I think a lot of our Hispanic community members are worried about running for office.
Mhm.
I feel I think they're disenfranchised, I think. Um, and we're looking for them to step up. And I know I'm not the trusted messenger on this, but whatever we can do to get them in office and, you know, help us, you know, find our way and what the best thing to do for those communities, we are open with open ears. So
Thank you. And I believe I have time for one more. I really like this question because it looks like the audience is really appreciating the wealth of information that is coming from each level of government. And so Laura VT says, I like the try it today. Do you work in teams like this during the session to keep the information flowing just the way that it is now, from state to local and in reverse?
So
And if, yeah,
okay.
go ahead.
So you know, a lot of session is an insane period of time. We have so many bills, so many hearings, and it really is as running from one meeting to the other, and it's chaos. What we tend to do is actually do a lot of that work during interim. And hopefully that is what you will find when you watch the TVW interim work that we're doing, or the meetings that we have. That is where we collaborate. That's where we make sure we hear from everybody, all levels of government, all the levels of providers who are providing care. So all of that work is done before session starts. When session starts, hopefully you're good to go, you're ready to go, and you start making tweaks and changes and amendments and, you know, working with your colleagues. But I especially always want to make sure that a lot of that work has been done in the interim. And frankly, if it hasn't been done, those are the bills that have the hardest time passing, because people always want to say yes or no, or say, have you considered this? So that's why many times it takes bills 2, 3, 4, 5 years to get through Olympia, is because they really have to be worked out. You have to make sure that all the stakeholders have their voices heard, that people have had the opportunity to provide input before something becomes becomes law. And even once it becomes law, you'll be working on refining it for another few years.
True. So I concur. I work very closely with our local municipal. Where I live, we don't have a city. We're just an island. We're all rural, but the rest of the county, we have Oak Harbor, and we work with the mayor of Oak Harbor, the mayor of Coopville. So we work with our locals, and then I work very closely with my state electeds, Dave Paul, as well as state electeds in my area that, or where, for example, with Senator Dingra, or I'll be reaching out to electeds I know from other districts who have experience in this. I've worked closely with Lauren Davis and Senator Claire Wilson on issues. So we work hard all year long to work with our federal and state electeds. I sit on Health Policy Committee at a national level, and then I work through WASAC, the Washington State Association of Counties, and I know there have been occasional joint meetings with the Washington State Association of Cities. These are the stakeholders we try to be engaged, and we ask to be engaged early in legislation so we can be allies in the right thing and not be last minute barriers to getting things passed. Understanding what's happening at the local level, we hope to be helpful in passing good legislation by being early stakeholders in the process.
Thank you.
Okay, so I guess, well, on my side of the mountains over here, I kind of envy you guys over there on the west side. Our county commissioners are, what's the appropriate, let's just call them stubborn. They're very stubborn, and sometimes it is hard to get things done. For example, we haven't had an annexation since 2006. So we are due for an annexation. The city needs to grow. The county does not always appreciate our efforts, you know, when it comes to their funding, because they lose some of that funding. So so there are difficulties that need to be managed. Our elected representatives are all in the minority. Sometimes it is hard for them to pass bills, you know, locally if they're in the minority, and they don't always do a great job of reaching across the aisle, and it gets into a very political discussion at that point. But I think there's a lot of work to be done, but there are common grounds I think that we can find, especially within the budget capacities. You know, there are things they know that they have to do to stay elected. And I think they're starting to get to the point where they will work across the aisle energetically. So, you know, encouraging them to reach across and you know, work through party politics can be vitally important to the success of our region.
Thank you. So we're almost done. So essentially, what is the takeaway? I'll give you an option of answering either or. The first question is, what advice do you have for constituents who want to get involved in behavioral health advocacy at the state, county, or city level? Or I'll give you the other option of, what do you think, what would you like the audience to take away from this? Please answer whichever you would like.
Okay, well, hopefully my answer will combine the two. You know, I think stories are really, really important. Stories stay with people. They help them realize why something is important, why we should care. And so I had put my email address up in the chats, and really to tell you all that if you would like to come testify, if there's something that you want to share your story, please do. Even, you know, and I know I said I'm on the board of Nominee Side, so I'll say, you know, programs like In Our Own Voices, where you really are talking about your experience. They're just so powerful. And I don't care whether you're Democrat or Republican, when you hear those stories, you have to be moved. And so putting that human element and that experience front and center really makes people understand why they need to support policy, why they need to prioritize funding, and what they need to do to make people's lives better. So all of you have that unique story to tell. And when I was part of the NAMI Eastside Public Policy Committee, we used to call a one-page sheet the heart and the head. So have a personal story on one side. On the other side, you can talk about the details of the policy and the numbers of the funding. But I think they go hand in hand. And like I said before too, all of you can make sure you're destigmatizing behavioral health. It's a medical issue. And like I said, we need to be making sure that every care we get is from your head all the way down to your toes.
So I've said for a while that democracy works best when we all show up. So from my perspective, I know there are many elected officials where for whatever reason, they don't love public engagement. And I love public engagement, even when there are those who don't agree with me, because how do we refine our ideas if we don't engage with people like you that really understand firsthand what the issues are? So I encourage you to engage, and I encourage you to join at a local level advocacy organizations, or things like every county in Washington state has to have a community health improvement plan. It's critical that behavioral health be part of that plan and that we address these issues. Show up at your county meetings and let your voice be heard. Talk about, for many conservative communities, issues like medically assisted treatment for some reason is controversial, and yet medically assisted treatment is vital to what we're trying to do. So show up and let your elected leaders know that you support those programs in our jails. You support joint outreach like Cahoots or like we're doing here in Island County, because your voice matters and it sways the opinion on the dais. So whether you're showing up through letters, emails, or most effectively show up in person and tell your elected leaders, this is important to me, this is my story, this is my family, this is my child, and these programs, these services matter.
So kind of a personal story of, some events that happened in East Wenatchee. Since I've been on council, the only time we really had city council meetings that were standing room only was when they were actually trying to put a recovery house, a couple blocks away from my own house. Now, there were some serious issues regarding this group that was trying to move in. It was kind of a for-profit situation, and they weren't actually looking out for the best interest of those that were dealing with behavioral health and recovery. So, there were some serious issues, but the city itself, and the community members, the neighbors, they were on the warpath, and they were able to stop it. But, one of the things they all recognized was there needs to be places and facilities for people with behavioral health and recovery issues to deal with their problems, and to have an open dialogue and be able to speak like, so where is the appropriate place? Where should we actually do this? That step, that conversation was never available. So they all flipped out. But when we were able to sit down and talk to them, every one of them was able to admit, like, yes, we do need a place for these individuals to seek treatment. And then the question becomes, okay, how do we actually fix this? Where is the appropriate location? Where is the appropriate place for this? So being able to create an environment where you can have those difficult, uncomfortable conversations is vital, especially at the local government area.
Thank you so much. And that's all the time we have for the questions. I wanted to ask our panelists if they have one last thought before we start wrapping up.
I'll just say thank you for putting this platform together. Thank you for being so engaged. Thank you for the questions. And I'm really excited to have this conversation, and I'm always happy to come back.
Thank you.
So I'd echo that. Thank you for inviting me to be part of this conversation. there is a chapter of Recovery Alliance over on my island, or the other island, and I appreciate the work up here to build the capacity and voice of my community. So thank you for hosting this and allowing me to be part of it.
Thank you.
Thank you.
Just want to say I love being part of these groups, the Washington Recovery Alliance. You know, to me, it's like I get to be my most true self. You know, I can be vulnerable, I can be open, you know, I can share my experiences, and you know, it makes me so much more excited to go do the work on these projects because of that.
Thank you so much. Thank you for being here. Once again, this was an incredible conversation. State Senator Magda Dingra, Island County Commissioner Janet St. Clair, East Wenatchee City Council Member Matthew Hebner. Thank you so much for being here. For the audience, I'm just going to give it to Heather to close this up. But before that, I wanted to tell the audience, you know, I just hope that you gained a lot of information about the role of state, county, and city government in the behavioral health system. I hope that you can take this information and it can help you with whatever it is that you want to do. But I can definitely say personally, it's going to help me in my own advocacy work. Before, I wanted to say, I hope that this once again helps you in your advocacy effort. But one thing that will also help you is our Elevate training. It is our public policy and media engagement signature program. It teaches you how to tell your story in a very compelling way to policymakers. It helps you to understand about the level of governments and how they work, and how to work with the media and how to get involved with the recovery movement. There's one coming up August 8th from 10 to 4, and the registration is in the WRA website. Did I get that right, Teresa and Heather? And Heather, take it on.
Hi, everyone. Thank you so much to our fabulous lawmakers. We're so grateful that you joined us today. What a rich conversation. I am excited and energized to keep moving and sharing our stories and working together to create even greater progress in our behavioral health services and communities. If you're interested in joining us, Teresa, could you go to the 2 slides that we have? That the next KCRC Presents will be on August 20th, and we are having author Erica C. Barnett, who wrote the book Quitter, a memoir of drinking, relapse, and recovery. And she's also a journalist and a blogger. Her blog is called The C is for Crank. She's going to be sharing her lived experience with recovery and her experience in going through receiving services, relapsing, her perspective as a journalist, and more amazing information will be coming from Erica. It will be moderated by Brad Feingood, a member of our advisory board for King County Recovery Coalition and the Washington Recovery Alliance. And then we have some other August events that Ellie spoke to. Teresa, can you set? So here we go. So on Wednesday, next week at 6:30 p.m., the King County Recovery Coalition is holding its first coalition meeting since COVID hit. And we are coming back together as a coalition and talking about what we do to affect policy and promote public understanding to reduce stigma. We will be having a conversation around the report on the impact of COVID-19 on behavioral health for our entire community and the types of services and supports that we can turn to. Then we will have a discussion about our Recovery Month events that we will be doing during the month of September, which is National Recovery Month. And all I will say is it involves a scavenger hunt, and everybody can play, and you can get more details there and help us with sharing the word. And we're just going to come together and really get our coalition moving for the advocacy work that is ours to do this year and at this time. Later in the week, There will be the Elevate training on August 8th is also a virtual event, and you can register for that as well. And then, which is amazing, and you learn a really wonderful way to share your story. I've gotten to go to Olympia to our Recovery Advocacy Day 2 different years now and share my story and listen to other people share their story, and it's just remarkable. And it does have an impact. So please come learn how to share your story. And then in September, our KCRC Presents will be focusing on recovery coaching, and we're going to talk a bit about the CCAR model and some other things, and what would that be like for our state here. Thank you very much for attending today. I will be sending out the link to our conversation in an email by this weekend. And once again, just thank you to Senator Dingra, thank you to Commissioner St. Clair, and to Councilman Hepner for joining us this day, and for everyone else who took the time out of your day to come be a part of our conversation. Thank you so much, and have a great day.
Thank you.
Bye, everyone.